Yes.
Today is our first presentation in the month of March, and March is the month of nutrition. If there are any two products or two items that you should pay attention to improve your health or what it is now, number one, water. Number two, fiber. Vast majority of the people somehow do not pay attention to water and fiber. Even though everybody wants to have their own water bottle on the go everywhere, but drinking enough water for your body is still a challenge for many. That is a bit less challenge than eating the right kind of fiber. Today, we have our excellent, young, energetic nutritionist, Miss Kanishka Upadhyay, is going to talk to you about fiber, your colon's best friend. With that, let's invite Ms. Kanishka Upadhyay. Please present.
Thank you so much, sir, for the invite, and a very good morning to one and all. And it feels great to be back here again with another webinar. So I'll be just sharing my screen now. I hope my slides are visible.
Yes, we can see it, Kanisha.
Thank you. So today I'm going to introduce you to your best friend. No, it's not a human, but something that is found in your kitchens and plays a vital role in maintaining your gut health. We are going to talk about dietary fiber. Fiber, your colon's best friend. So let's get started. Now, this is going to be the flow of today's discussion where we are going to discuss about the different types of fiber, the sources, the functions it plays, and most important, the gut-brain axis. Also, we'll be discussing about the role of fiber in colon health and things like how much fiber is actually required, especially by the elderly, and also some other important topics. So let's get started. A very interesting fact to know is that the surface area of your gastrointestinal tract is as big as a tennis court. Isn't it interesting? Which means that we are more bacteria than human because a healthy adult gut can harbor around 100 trillion bacteria in such a huge surface area. So basically, it's also said that we have two brains. First is obviously, which we all use on a day-to-day basis, and our second brain is called our gut. So basically, gut is our second brain, and you all must have, used this term quite frequently. Like, I have this gut feeling, right? So basically, gut is something which plays a very important role in maintaining our metabolism, in the aging process, as well as, in preventing us from various diseases. So it's very important to have a healthy gut microbiome, a healthy gut which harbors good bacteria. Now, what is a healthy gut? As I just told you that our GI tract is full of trillions of bacteria which help us in processing the food which we eat and also help our bodies maintain the homeostasis, that is the balance and overall well-being. As you can see here in this image, this is a sick gut. Okay, sick gut when you are eating a lot of processed foods low in fiber. And this is a healthy gut. Now, a question arises is that is there any ideal gut? The answer to this is no, because everyone's gut is different, right? So no matter how many type or number of bacteria there are, what is important is that the bacteria in one's gut are able to function at their best capacity at their optimal levels, which means that we can't classify, we can't give some parameter for a healthy gut. It differs from person to person, but there are few important factors which determine whether your gut will harbor good bacteria or bad bacteria. So as soon as an infant is born, that's the phase from when the gut microbiome it begins to develop, okay, from very early stage in life. So when an infant is born and when it feeds on mother's breast milk, so the mother's breast milk also contains certain nutritional factors which will help in maintaining a healthy gut. Apart from it, age, stress, the type of environment you are exposed to, the type of medications you are taking. For example, if someone is having a lot of antibiotics, then it will also affect the gut microbiome. And the most important factor, which we are going to discuss today, is diet. Diet plays a very important role in maintaining a healthy gut. So now let's talk about your best friend, dietary fiber. So what exactly is fiber? Fiber is a type of a complex carbohydrate which cannot be digested or absorbed in your small intestine, right? Everything that you eat, for example, your fruits, vegetables, wheat, seeds, etc. All of these are your fiber. But what is important is the type of fiber which you are consuming, which we will be discussing in the subsequent slides. Before that, let's talk about, in general, the potential benefits of dietary fiber. First thing, it helps in aiding digestion. Okay. Secondly, it helps to lower down the cholesterol levels. So people with heart disease like atherosclerosis or blood pressure, they are advised to consume good amount of fiber, which will eventually bring down their cholesterol levels. Also, for diabetics, it's a boom. It helps in maintaining stable blood sugar levels, and it also helps with weight loss. And now the dietary fiber is recognized as an essential nutrient. So we know that there are macronutrients, that is your carbohydrate, protein, fat, and water. And there are micronutrients like vitamins, minerals, and certain essential fatty acids. Dietary fiber is now a very important macronutrient which has been recently added. This is something that you should know. Now, coming on to the types of fiber. So there are two types of fiber, soluble fiber and insoluble fiber. As the name suggests, soluble fiber, which means that it is soluble in water. Insoluble fiber is insoluble in water. Now, the examples include like your pectins, which are found in your fruits and vegetables, oats. Oats contain beta glucan, which is very much important in lowering down your cholesterol levels. Your flax seeds, chia seeds, fruits, lentils, all of them are rich in soluble fiber. Even your bananas contain inulin, so a very good source of soluble fiber. The next type is the insoluble fiber, which you can easily get when you are consuming your whole wheat or when you're consuming the bran of wheat, okay, and also when you're consuming your broccoli, etc. So these are the food sources of soluble and insoluble fiber. And mostly what happens is that when we are consuming a diet, then we should make sure that our fiber is coming from both of these soluble as well as insoluble sources. Now, what is fermentable fiber? Fermentable fiber is something which gets fermented in your colon, right? Colon is the last part, the end part of your GI tract. So you have the small intestine and then you have the large intestine. So here the fermentable fiber, it basically helps in increasing the healthy bacteria in your colon. So we will talk about it in the subsequent slides. Now, these are the sources of dietary fiber and how much a particular food product provides you, like how many grams of fiber. So you have your apples, you have your avocados, your oats, almonds, chia seeds. All of these are excellent sources of dietary fiber, especially chia seeds. If you consume early morning, okay, they help a lot in your motions as well, smooth motions. Now, let's discuss the functions of soluble and insoluble fiber. Firstly, as I already mentioned, that soluble fiber is soluble in water, right? So it attracts water and it will turn into a gel-like structure. And when it will turn into a gel-like structure, what will happen is if you're consuming, let's say, oats, is rich in soluble fiber. So once you consume oats, you will feel full. It will slow down the digestion process and it will induce satiety. So basically, soluble fiber is excellent for those who are looking for weight loss. And additionally, it also lowers down the blood cholesterol levels. Coming on to the insoluble fiber, which we also call as roughage, right? So the insoluble fiber, it is made up of non-soluble cellulose. It is insoluble in water. Okay. So what it does is its main function is to add bulk to prevent constipation. For people who are constipated, they're advised to consume more of insoluble fiber, okay, such as your wheat bran, etc. Now, if we talk about the common functions of both of these, then the major role played by them is that they help in decreasing your blood glucose levels and ensure a good glucose control as well as insulin response. So basically, what you should understand is that your diet should consist of both soluble as well as insoluble fiber because both of them have their own benefits to offer.
I've never taken a
Now,
shower in that.
as I just said that your gut is your second brain, which means that we have to treat our brain well, right? So now let's discuss the factors which will actually help in maintaining a good gut microbiome. So here you can see in this picture, overall, if you have a positive mental health and if your diet is high in fiber, which means that you're consuming enough of your vegetables, your fruits, fermented foods, etc. Apart from consuming, foods which are rich in anti-inflammatory agents, omega-3 rich, and low fat and low carbohydrates. So all these factors will ensure that the microbiome in your gut is healthy. It is good. Whereas factors like poor mental health, too much of stress, because in this busy lifestyle, we are so much busy that we, forget to pay attention to our mental health as well. And having foods which are rich in HFSS, that is high in fat, sugar, and salt, like your chocolates, your donuts, pizza, etc., will result in inflammation. And eventually, you should know that inflammation is the root cause of each and every disease, be it your obesity, be it your diabetes, etc. So basically, if you are consuming a diet which is very much high in processed foods, it will negatively impact your gut microbiome. So one should ensure that to consume a diet which is high in fiber. Now, we know that fiber is our best friend, right? So we are like a host, okay? So when your best friend comes to visit you, you provide them with, good snacks or good breakfast, everything. Similarly, the human is like a host, which provides nutrients and shelter for the microbiome to survive. So just like when your best friend comes to your home, you ensure that whatever you are serving to them is, good, it is healthy, or maybe it is, in optimum quality. Similarly, as a human host, we should try our best to provide those nutrients which will eventually help the microbiome to grow in a healthy way. So what are those essential nutrients? So we have vitamin B12, vitamin K, folic acid, riboflavin, etc., which we should provide to the microbiome by consuming foods which are rich in these, right? So basically, if you are having a healthy diet, okay, if you are consuming enough fiber in your diet, you are making sure that you are providing enough of these nutrients and a good environment for the microbiome to develop. Now, why is fiber your gut's best friend? Okay, so to understand this, again, we'll be focusing on the very important functions played by the fiber in your colon, right? So this is your colon where the good bacteria, they will act on the fiber which you are consuming and will break them into short chain fatty acids. Okay, so short chain fatty acids are the ones which will provide anti-inflammatory activity to the cells in your body and will stop them from becoming cancerous. So basically, you can understand it in a very simple way that fiber is like an agent which will prevent you from cancer, especially colon cancer, which is very much common these days. And apart from that, here in your colon itself, the fiber, especially the insoluble fiber, will increase the bulk of the stool, and it will, it will actually wipe away all the cancer-causing agents. Okay. Apart from that, all the harmful agents, and easily you can be cancer free. You can be protected from cancer. Apart from that, will also ensure that you are not constipated. It will make sure that your stools are normal. Let's understand this in a very simple manner. So this has been given by the American Institute for Cancer Research. If you look at your intestine, okay, your intestinal epithelium, we need to understand two key terms over here. Prebiotics. Okay, so what are prebiotics? Prebiotics are also a type of fiber which provide a good medium for your gut microbiota to survive. For example, the bananas you eat, they contain inulin. So inulin is a prebiotic which will help your gut microbiota to thrive in a healthy environment. Now, what are probiotics? For example, you consume curd, right? Curd is very much rich in probiotics. So these probiotics, they require prebiotics to ensure that a healthy environment is there so that the good bacteria like your bifidobacteria, lactobacilli, etc., are able to survive. And once they are able to survive well, they will ensure that whenever you're eating fiber rich foods or anything, whenever you're eating, the fermentation process will begin. And once the fermentation process has started, this is very important. This is your you can say a second best friend, known as short chain fatty acid, which I just discussed in the previous slide. This short chain fatty acid ensures that in your colon there's a drop of pH, so that uh, all your anti-cancer factors or all your inflammatory factors are not able to survive, which will eventually ensure that your colonic health is well maintained. So basically, one thing we have to keep in mind from this slide is that we should consume enough of prebiotics as well as probiotics. Prebiotics is your fiber, which you are getting from your fruits, vegetables, pulses, legumes, etc., which will ensure that your gut microbiome is healthy. It is harboring a good population of bacteria. Now, the role of fiber in colon health. Firstly, it prevents constipation, right? So as I just mentioned, that insoluble dietary fiber, which you get from your wheat, okay, from your seeds, it will act as a broom to sweep out the digestive tract. So it will actually help in making your stools very easy to pass and decrease the chance of constipation. So if anyone of you is suffering from constipation, please make sure to add enough fiber to your diet. Now, another consequence of an inadequate fiber diet can be hemorrhoids, which we call as piles as well. So what happens is that there is difficulty in passing stools, okay? And one of the reason of hemorrhoid is actually constipation itself. So this you can see are the causes of hemorrhoids, that is chronic constipation, frequent diarrhea. Even if you are overweight or obese, it can also increase your chances to get hemorrhoids. One should ensure that the diet is rich in fiber so as to firstly prevent constipation. And if you are able to prevent constipation, eventually you will be safe from hemorrhoids. Also, fiber prevents the inflammatory bowel disease known as IBD. So many people they're not able to even diagnose this disease because they're unable to identify the clinical manifestations as well. So just remember two important things. Firstly, IBD is of two types: Crohn's disease and ulcerative colitis. Since we are discussing about the colon health, so I'm going to shed light upon ulcerative colitis. Ulcerative colitis is chronic immune mediated disease. So basically, it occurs because of some, immunoregulatory factors which are responsible for this condition. And also, if there is a lot of inflammation in your colon area, right? So as you can see, yeah, this is your colon. So these are the parts of your colon, the ascending part, the transverse part, and the descending part. Along with it, this is your rectum. So if this particular region is affected, okay, and the consequences, like I mean, the causes can be many, but fiber, the lack of fiber in the diet is the main cause. Because if you don't have enough fiber in your diet, so the fiber won't be able to protect your colon from inflammation, right? So it's very important that you take good fiber, which will help in reducing the gut inflammation. Now, let's talk about some more benefits of fiber. Firstly, as I mentioned, it reduces the gut inflammation, so which is very much important because if there is significant inflammation in your gut, it can make you susceptible to various diseases, right? Secondly, it also helps to maintain uh, a good balance of the microbiome. Basically, it will help in promoting fiber will help in promoting the growth of the beneficial gut bacteria and will decrease the pathogenic bacteria which can cause diseases. So you can just understand how much important fiber is and why I'm calling it as our best friend, right? It always wants us to see growing. So it will always promote the growth of the good bacteria, right? And also, it plays a very important role in the regulation of our immune system. So basically, it will prevent or it can reduce the levels of carcinogens in our gut, in our colon, and also it will significantly increase the levels of your short chain fatty acids, which help in preventing inflammation. So it will basically reduce your risk of cancer and it will also promote a good quality of life because we all know that the gut issues are so severe that people suffer from it on a daily basis. So it's very much important that one should be able to promote a healthy gut in both children, adults, as well as the elderly. So fiber is very much important part of your diet. What are the benefits of a diet which is rich in fiber? So this we have already discussed. Firstly, it will help in increasing the population of the good bacteria, right? Secondly, it will also help in increasing the short chain fatty acids. Third, it will help to increase your insulin sensitivity. So basically, those who are diabetics, they should especially include a lot of soluble fiber in their diet, and it helps in improving your overall metabolism of the body. A very important question, that how much fiber is needed, right? So firstly, the older adults, especially older adults, need slightly less fiber than the younger adults, and among them, men require more fiber than women. So this you can see is the adequate intake of a fiber. So for those who are between the age group of 51 to 70, men require 30 grams of fiber, women require 21 grams. Those who are 71 plus and above, they require 30 and 21, same amount. So for you people, it's not necessary to learn the numbers, but what is important is how you can incorporate fiber in your diet, right? So we are going to discuss about that also. So it's very important to get the right amount of fiber, because if the fiber intake is too less, you are prone to having constipation and certain chronic diseases, right? But also, we know that too much of something is also very bad, right? So if too much fiber in your diet, that is more than 60 grams per day, can cause gastrointestinal issues like bloating, gas, cramping, etc. Now, here are few strategies which can help the older adults to make sure that they have enough fiber in their diet. Firstly, when you are going for shopping, you have to make sure that you are purchasing foods which are naturally high in fiber, like fruits, vegetables, legumes, and whole grains. And for that purpose, also you have to read the food labels for fiber content. So I'll be shedding some light upon this topic as well, how to actually decode the food labels and understand the fiber content which is good for you. And also, while meal preparation, try your best to incorporate the plant-based food options into your meals. Okay, for example, you can incorporate sprouts when you're making khichdi, right? So these are very simple techniques which you can take into consideration. Or if you're having oats, oats itself is a very good source of fiber. You can add fruits to it, berries to it, nuts to it, right? And also during your lunch and dinner, you can include a serving of vegetables or salad. And try your best to choose whole grains over refined grains like maida and other processed foods. And also for the older adults, especially if who have difficulty in chewing, one can ensure that your vegetables which you are serving them, they should be properly boiled, they should be properly cooked, and their texture should be soft enough for the older adults with chewing difficulty to swallow it. Now, what are the 10 signs, that indicate that you have an unhealthy gut? So, firstly, you have to look for these signs like you're having a lot of anxiety issues. So, many people don't even realize that even anxiety, depression, mood swings are all linked to your gut. If you have poor memory, diabetes, skin problems. So, what we say is when you look at the skin of a person, if you see that the skin is quite unclear, or the person is suffering from any of the skin disease or any problem, the major root cause is usually the gut. So you can understand that it all starts from the gut and it ends in the gut itself, right? And if someone is falling ill too much, too frequently, then that is also a sign which you should understand that yes, you have an unhealthy gut and you have to do something about it. So let's talk about the fiber-rich foods for a healthy colon, starting with the prebiotics. As we discussed, these prebiotics will help in ensuring that in your gut, the beneficial bacteria only harbor. For example, you have your oats, your bananas, garlic, a very common ingredient which is there in our kitchens and which we, use in our meals as well. Then you have your onions, then your nuts, fruits, etc. So all these are your prebiotics. And what happens is that this prebiotic fiber, it goes through your colon and it gets fermented there. And there it will increase the population of the desirable bacteria, which will ensure that you are less prone to diseases. So these are some of the prebiotic rich foods you have here. Green leafy vegetables, the garlic, onion, banana, oats, which are there, which we use in our day-to-day life. Now, you also have to make some room for legumes as well. Okay, legumes are a great source of fiber. So make sure that you include them in your meals. Now, here you can see this is your whole, tract, GI tract. So here you can see you have your foods which are rich in fiber. Along with it, also, foods which are rich in omega-3 and prebiotics, zinc, etc. So basically, make sure that you eat like a rainbow. You include all the different colorful food items in your diet for a better gut. Whole grains. So yeah, definitely, because whole grains are very much rich in fiber. So one should switch to whole grains and ditch the refined grains. So make sure that you're eating more of fruits and vegetables. For example, you can start your breakfast with whole grain breads. Okay, your pancakes can be made up of whole grain. And your lunch also, you can have brown rice. In your dinner, you can have, let's say, quinoa. Even quinoa is good form of fiber, as well as simple chapati might also work. And when you're having snacks, so make sure that you don't, have the unhealthy snacks, the processed snacks. It's better if you have rather, a granola bar, because even a granola bar, if it is made using, nuts and seeds and also not sugar, but maybe some good alternative, it can also help to ensure that your fiber intake is good. And also, the fiber-rich foods which you will be consuming throughout the day will also ensure that you don't feel hungry again, right? And one more important tip is that when you are having fiber, make sure that you drink enough of water as well. So drinking plenty of fluids is very much important. Now, let's understand something new today. As I told you, when you go to the grocery store, okay, and when you buy any, packaged food item, how to be fiber smart, how to understand that, okay, this particular food product is a good source of fiber, so yes, I can buy it, right? Firstly, when you're looking at the food labels, look for the word whole, right? If it is made up of whole wheat flour, whole grain, etc. Secondly, if you look at the nutrition facts, so I understand for many people it's very much difficult to read the food labels, for a common man especially. So basically, a simple tip is if your dietary fiber is 6 grams or more than 6 grams, then definitely that particular food product which you are purchasing is a good source of fiber. But it feels like, like 3 or 2 grams, something like that. Trust me, it's not a good source of fiber. So basically, just remember this figure, 6 grams. Okay. So dietary fiber, 6 grams, if it's mentioned, it is a good source. You can have it. So now I'm here with a quick question for all of you. You all must be familiar with Maggi, right? The 2-minute noodles we all have. Now, our marketing industry has done this thing that they have introduced, your Maggi made up of refined flour, Maggi made up of atta, oats Maggi. But are they really healthy? Like, this is a very basic question. Are they really healthy? So, can any one of you tell me, looking at their fiber content, is it a good source of fiber? Anyone?
Comparatively, Atta Maggi is better, saying 5 gram, but that's still not up to that 6 gram thing.
Right, exactly. Comparatively, yes, we can say that it is better, as compared to, and surprisingly, oats Maggi contains 4 grams of fiber. So these all are like, per 100 grams each, the values are given. So a very simple hack is that when you're purchasing anything, be it any packaged food product, do look at the fiber content and be fiber smart. So the take home message for you all is that, especially for the older adults, fiber is a very important nutrient. It's like your best friend, which will ensure that your gut is happy, which will eventually ensure that you are happy, because it will help in preventing constipation, and also it plays a very important role in heart health, in preventing you from diabetes, being overweight, obese, right? And many people, they do not eat enough fiber. So it's very much important that we incorporate a plant-based foods, plant-based meal into our daily life, which will ensure that we are able to meet our fiber needs on a day-to-day basis. So these are the references which I use. And thank you, everyone. Thanks a lot.
Very good.
If anyone has anything to ask, so please feel free to ask.
May I please? I do have a question.
Yeah, please go ahead.
You mentioned about the arthritis, and I do have a problem with arthritis. I was doing some research, of course, Google. They said the nightshade vegetables like tomatoes and bell pepper and eggplant is creating inflammation, and I should avoid it. I wanted to hear from you, if someone has arthritis, what should we avoid?
Yeah.
And
Okay. Thank you. So,
bye.
yeah, I understood your question. So basically, arthritis is a condition which is linked with inflammation, right? And the vegetables you're mentioning, like tomatoes, potatoes, even your eggplant. So all of these, they belong to a nightshade family of vegetables, and they contain a chemical known as solanine. Solanine is a chemical which can actually cause inflammation, and it will aggravate your pain during arthritis. So yes, it's better to avoid them. And the alternatives, like, which you can take apart from these vegetables, can be your citrus fruits. Citrus fruits like your oranges, you have your sweet lime, your grapefruits, amla, etc. Because these are rich in vitamin C. And if you're consuming enough of vitamin C rich foods in your diet, it will help in preventing that inflammation, and also it will reduce the pain also. So yeah, you are right. Absolutely correct.
Thank you very much. I appreciate.
Thank you.
I have a question. You mentioned about yogurt, probiotic. Should it be probiotic yogurt or it can be regular yogurt?
Can you please repeat your question, ma'am?
You were mentioning about yogurt, probiotic. So should we go with the probiotic yogurt or regular yogurt is also probiotic?
I'm actually unable to hear the last what you're saying. Probiotic and prebiotic. Uh, After that,
So she's asking, is a probiotic
yeah.
yogurt is same as the regular yogurt?
Okay. Okay. So basically, yogurt is definitely a good probiotic, and it will help in boosting the healthy microbes in your gut. So yeah, it is different. It's not a prebiotic; it's a probiotic.
Oh, thank you.
Is that what you asked? Yeah. Thank you.
Yeah, the difference between regular yogurt and probiotic yogurt.
Between
I have a question. I have a very weak gut, like many things don't agree with my stomach. I get a lot of bloating and gas, and then I get constipated if I don't eat the proper food and all that, like vegetables and all that. But at the same time, I wanted to know that yogurt, I eat vegetables, dal, rice, and like sometimes chapati. But what do you think? Which fruits, like banana, you said was good, right? And so if you give us a list of foods that you shouldn't be constipated, and what a probiotic, like, I mean, we heard you, we read what was there, but we want specific things. I'm a vegetarian, so would like to know what I could eat so that my gut is good and I don't have to take any supplements for going to the bath the same morning. But sometimes I even take that what is it called, that fiber powder you get, like an orange flavor or whatever. Is it good to take or not?
Okay, thank you so much for the question. So I'll answer it one by one. Firstly, the food options, if you are constipated, can be banana is excellent and it will work better if you incorporate that banana. Like, if you mash the banana and eat it with curd. Secondly,
Okay.
prunes. Prunes are great. Prunes, pigs, and another good, like a very small tip I'll give you is overnight. What you can do is you can soak 10 raisins overnight, and the next morning when you
Oh,
get up, empty stomach,
good.
trust me, do this
No,
for like yeah,
Your
for
voice
a
is breaking, Kanishka.
okay. My voice is breaking. Am I audible now?
Yes.
Yeah. Okay, I think there's some network issue. Yeah, so if you consume like these all food items, like for example, I'll again repeat, pigs, prunes, banana with curd, oats, and then you have your raisins, especially black raisins, soaked overnight in let's say half glass water. And if you
mhm,
consume it very next morning, empty
yeah.
stomach, it will help in relieving your constipation problem. So
Okay.
try to do this for a period of 7 to 10 days. You will see results. And in case you can't do with raisins, you can try soaked pigs. They are also very helpful.
What is that? I
And
didn't.
next, soaked pigs. Pigs. You call it anjeer.
Anjeer. Oh, yeah. Yeah, I have prunes also, but I don't soak them. I just eat like that.
Yeah. And apart from that, you also have papaya. Okay, papaya is an excellent fruit
Yes,
if you
yes.
are constipated. Yeah. And next thing, when you talk about the sources of probiotics, curd is definitely one of them. Also, what you can do is at your home, you can try making fermented cabbage, or fermented carrots. So these are also good sources of probiotics. And apart from that, coming on to taking dietary supplements, supplements are advisable if having fiber from natural sources is not helping you enough.
Okay.
So my suggestion would be maybe first you can try with a diet which is good in a particular type of fiber. Basically, soluble fiber is good for constipation problems.
Okay. I get a lot of bloating and gas
Okay,
also,
so even for bloating issues, ma'am, I would like to suggest you a very small tip. You have this jeera powder, right? Roasted jeera powder.
right?
You can, yeah, you can sprinkle it in your curd. And second option would be the best one, which works a lot with my clients, is that you can have soft water, fennel seeds water,
Salt water.
fennel seeds,
Soft.
fennel
Oh,
seeds.
yeah.
Yeah, these are your fennel seeds. They're green in
Yeah.
color. Yeah. So fennel seeds
Thank you
water you can try.
so much. Thank you.
Yeah,
But
thank you.
someone had told me banana is not good for your stomach. But I feel banana is very ripe, I shouldn't eat. But if they are good, like firm, that they have fiber, right?
Right, and unless it's not causing you a problem, there's no harm.
Okay. All right.
Have it with curd. That will be better.
Thank you. Thank you very much. The sound is breaking.
Yeah, the sound breaking actually.
Thank you very much.
Thank you.
Can I ask one more question? I don't want to take off your everybody's time, but I do have a concern. I am dealing with the Alzheimer and dementia patient, my spouse, and I was reading a book and it says that I should cut out all the dairy products completely to avoid the Alzheimer. Is that true? It's a 30-day Alzheimer guidance book by very well-known authors, and I'm reading it and I'm going to try it, but I think your opinion would be very good on it. Thank you.
Thank you so much for your question.
We can't hear you, Kanishka.
Are you able to hear me now?
The voice is not clear.
Yeah, now we can hear you.
Now you can hear. Okay. So Alzheimer's, which is
We cannot hear it.
just a minute. Yeah.
What is the problem with that?
Am I audible?
Yes, Kanishka.
Yeah, no, it's breaking.
Yeah. So just a minute. I will connect my Bluetooth.
Again, we can't hear you.
Why diglyceraldehyde?
You're muted, Kanishka.
How am I audible?
Yes, we can hear you now.
So when we talk about Alzheimer's, Alzheimer's is also a condition which has an inflammatory origin. When we talk about dairy products, especially the dairy products which we get these days, like let's say your milk, especially, it is made with a lot of hormones. So definitely dairy products are inflammatory. But see, by just looking at a book, we can't, generalize that whether that particular like dairy product is bad for your health. So my advice to you would be that first of all, we need your blood reports and all. We need to check that what all are, your levels, like basically your blood parameters, which are elevated or which are not in synchrony. And then maybe we can plan up a diet which is individualized for you. But in general, if you see, then yes. Anyways, dairy along with gluten for the patients with Alzheimer's disease, even with Parkinson's disease, should be avoided to the best.
Thank you very much. I appreciate it.
Thank you. Any more questions?
Yes.
Yeah, I heard that the sugar is also play the important role in Alzheimer and dementia.
Yeah, it does. Actually,
Dr. Raj,
yeah.
yeah.
So when we talk about sugar, it's again a very broad topic. Sugar is like your bacteria's best friend. So basically, sugar will impact not only your gut health, but also it will cause other issues like your diabetes. Even it causes inflammation, causes cancer, and it has a role to play in Alzheimer's. But again, I would say we can't generalize. We need more research findings for that. The role of sugar in Alzheimer's. Yeah.
There is a scientific study. Dr. Raj, he's a very well-known surgeon also, and he's a very deep into the herbal and all this natural medicine. He was talking, there is an experiment done, and it says that like we get the cataract, the same thing with the sugar, we get fog on our brain. So it should be avoided. Later on, it will cause dementia.
Yeah, definitely. And in fact, sugar in any form, it's better to avoid. Yeah.
Okay, is there anyone else?
Yes.
Mute yourself.
Hello.
Yes.
Yes, Dr. We can hear you.
Hello, Kanishka.
Hello, sir.
Fiber is important, agreed. But certainly it is in many food items here and there. And generally people do not know whether a food item has fiber or not. But all of us know definitely that there's fiber in the brown rice. But brown rice cannot be eaten by everybody. And all the fiber in the brown rice is in the brown outer layer. And brown rice is good for two reasons. Even though the fiber is very good. It is not the quality of the fiber or the quantity of the fiber, but we eat a lot of rice, South Indians. And therefore, you will get that 30 grams of bran easily when they consume brown rice. The question is, when you cannot consume brown rice, can we just add 6 grams of bran, because rice contains 6% bran, for our curries or sambar or chutneys, whatever side dishes that we make, then it will not affect the white rice. Highly polished white rice can be eaten, provided if you take 6 grams of bran. If we do that, would it help to give my fiber or not?
Yes, sir. Thank you for your question. So you're very much right. It's very difficult to cook brown rice actually, and most of the nutritionists they even advise clients, patients to consume it for reducing the blood glucose levels. But definitely, including bran, be it a brown rice bran, wheat bran, or be it any form of fiber which you are including in your curries, in your dal. Even if you're having white rice, let's say you're making sambar rice also, we can actually add a small amount of that fiber, that bran fiber to it, which will increase the fiber content of the particular dish we are eating, and also it will ensure that there's no spike in your blood glucose level as well. So it's a very good option which you have mentioned, to include that bran, be it a brown rice bran or any other bran, in our curries, in our soups. Even we can sprinkle it on our salad as well. It will help in ensuring that we meet our daily fiber requirements.
So, if that is the right thing, then we can use the wheat bran for eating naan. Everybody says, oh, eating naan or maida is not healthy. But
Yes.
if you want to eat maida puri, and if somehow make wheat bran into one of the side dishes, would maida puri be okay or not?
Well, I won't say that maida puri will be okay, but what one can do is maybe make that puri with 50% wheat, 50% maida, and then you add that bran to it. So that will be a good wise option.
Okay.
Yeah.
So anybody wants to try on this group the bran powder? I can send you, but we have to establish a mechanism. As I said, that in 2024, we not only give you presentations, but we will be glad to give you products. And I hope that Geeta and others will see how we can get these products to you to test and understand rather than just listen.
Right. Doctor, we can do one thing. Send me a list of items which you want to distribute. I'll see like how many people are interested. Then I can get back to you with more information.
Sure, I'll send it.
I heard that Devendra has sent it to Amazon, those products he had made from Bombay. You were talking about some snacks and products like, but then someone told me that you can get it on Amazon. Is it true? I don't know, because I didn't get them here when I went there because I had no place in my bag, but otherwise I want to buy from here.
Possible, because the only difference is Amazon India and Amazon USA. There are certain arrangements for the Indian companies to ship from India, but the product cost is less and the shipping cost is high on Amazon. Unless you are on a Prime membership. Even then, when you are on Prime membership, when you open your account here, you cannot see your Prime membership on the Indian account. So unless these differences are gone, getting from India is not easy.
Okay, thank you.
I have one question regarding the, sambar. are very, very spicy food, those who are very has a habit to eat it, it doesn't affect them. But those who are not eating from the childhood, the spicy food, when they eat it, I get some, some kind of ulcer type in the mouth, and my stool when I go into bathroom, it's very burning sensation. And I'm sure that a lot of people who are not South Indian also has the same uh, effect. So what you suggest is with that, with spicy food?
Yeah. So firstly, ma'am, the first thing, like you're very much right. If let's say you're eating spicy food, all of a sudden and you're not habitual to it, then definitely it will affect the sensitivity of your gut. So one suggestion would be that don't start with, eating a spicy food, like very much spicy food. Start with having mild spicy food. And even if let's say the condition does not permits you to have mild spicy, you can make sure that you have something like curd with you, because curd will help in reducing that spiciness, which when you eat that food in your gut also, it will help in reducing that inflammation also. So this is one tip which I can give you. If you are eating spicy food, make sure to have it with some curd or your buttermilk.
Thank you. That's really helpful.
Yeah, thank you.
Excuse me, my name is Bala. I have a quick question, Kanishka, and that is whether spicy food in itself, is that bad for the colon or is it not? Is it okay?
Yeah, very good question actually. Spicy food itself, okay, first of all, let's understand one thing. There are certain spices which are definitely good for your colon health, right? For example, we have black pepper, we have cloves, okay? Cloves, if you make a spice of it, it's also good for your gut health. But if you're eating too much spicy food, then definitely I won't say that it is good for you, because again, it can cause a lot of we can say itching in your gut. Also, it will cause a lot of acidity problems to you. So it's better not to have that much spicy food, but to include a certain quantity of the spices which help in maintaining a good gut health. Let's say the black pepper, clove powder you can make, and also you have this cinnamon powder. Cinnamon powder is also very good for your gut health. So what you can do is, the strategy should be to include a minimal amount, an appropriate amount of the spices in your diet, which help in good gut health, and not increasing the overall spiciness level of your diet. That would be better.
Thank you.
Yeah.
And when you get the examination done, sorry, and what is this polyps they call it?
Polyps.
Yes.
Yes. Intestinal polyps. Yeah.
Yeah.
Yes.
I mean, in a colon, when you go for the checkup,
Yes.
so they
Yes.
tell you sometimes you have polyps, So what are they like? Are they very dangerous or something?
In the initial stage, they are not dangerous, but it will actually hurt you a lot because they are painful, and your stomach also starts hurting. So in the initial stage, they won't be dangerous, but definitely, like what I have read about, like in few of the papers, that these intestinal polyps may become cancerous in the later stage if not treated properly. So even there is some, in few cases, there is surgical intervention, but it's always best to consult your doctor for the best advice for
Right. I had only once I had it had come to the stomach, but otherwise it's a colon.
Yes. Okay, in
So
your colon. Okay, so you still
yeah,
have
because
it.
you go for your checkup every like 5 years or something, and then or 10 years. But yeah, they found some, so I wanted to know what they were, like the
Yeah.
doctor just
In the
tells you.
initial stage, they won't be that dangerous or harmful, but yeah, in the later stage, it can cause you problem.
Okay, thank you. Yeah.
Thank you.
Kanishka, one other question from me, Bala again.
Yeah.
Is there a recommended max of coffee and tea and other stuff to maintain your colon health? For example, just let's say coffee and tea. I mean, is it
Yeah.
bad? Is it good? What do you recommend?
Well, I won't say that, it is bad or good. So basically, coffee, first of all, it won't actually help you maintaining your gut health, your colon health, but because it contains caffeine, both tea and coffee, they contain caffeine. So ultimately, it will affect, first of all, your respiratory system, your cardiovascular health as well. But you can't say that it is good for your gut as such, because what eventually they will do is they will interfere with the absorption of the essential nutrients. For example, your tea. Okay, your tea contains tannins. So these tannins will interfere with the absorption of your nutrients. For example, if you're having, let's say, chapati with tea. So most of the especially Indian people, they have this habit of having tea with, parathas or chapati or idli, etc. So what will happen eventually is, even if you're having, let's say, idli, so the nutrients, whatever you're getting from idli, won't be able to be absorbed by your body, because you're drinking tea alongside it, and the tea contains tannins. So those tannins will eventually interfere with the nutrient absorption. So this is how the coffee and tea, both of them have effect on the nutrient absorption in your gut. So it will hamper the nutrient absorption basically. So it's not recommended, I would say, but definitely there are certain teas which are therapeutic as well. For example, your chamomile tea. Chamomile tea is especially good for patients who have sleep issues, and even the rose water or the rosemary tea, and also you have this cinnamon tea, which is very much good for diabetic patients. So if you are consuming tea, my suggestion would be to go for herbal teas. Like you can simply boil, your tulsi, and then your cinnamon powder you can add, and then you can consume it in the form of tea. Or you can go for your cinnamon or your lemon, green tea. All these are still good as compared to the normal tea, the normal chai and coffee which we have.
So just as a continuation, so let's say I must have tea with idli, just for the heck of it, okay? Is it
Yeah.
better to have the tea before the idlis, half an hour before the idlis, or half an hour after the idlis?
Okay.
I mean,
very good
or
question.
does it not matter at all?
No, it does matter. It does matter. See, first of all, let's say if you're having idli for your breakfast, okay, first thing, never ever drink tea on an empty stomach. Okay, most of in my family, most of the people are used to having tea on an empty stomach. So don't do that. What you can do is first have your idli and 30 minutes max. Okay, wait for 30 to 15 minutes max, I would rather say, and then you can have your tea or coffee, no issues. But don't consume it together with your meal.
Thank you.
Thank you.
Thank you.
Thank you.
Okay, now Balaji is ready to have idli with tea. Thank you, Kanishka. Thank you. Thank you for coming to
Thank you
India
for
Home.
asking so many good questions. Thanks a lot.
That's a good question, about tea and having things with it. Normally we do that. And I do nowadays, I've started eating something and then having tea.
Yeah, that's better. Never ever drink tea on an empty stomach. At least have
I've been
something.
eating all, how I've changed, I
Hello.
take a plate or two. Yeah.
Yeah.
What about milk with chapati?
Okay, when you talk about milk with chapati, again the same thing. See, milk contains calcium, and let's say you're having methi paratha. Let's say, okay, methi paratha, you're having fenugreek fenugreek paratha. So basically, now your fenugreek is a good source of iron for you, and milk is a good source of calcium for you. So that calcium and iron will actually fight with each other for absorption. So again, my advice for you would be that don't consume your milk, tea, coffee together with your meals. It is better to keep a gap of 15 minutes maximum.
Yeah, but toast and milk.
Yeah, you can have it. Fine, you can have it. But again, it's not a good practice, to do that.
Okay. Thank you. That's a good idea.
Thanks.
I mean, and the sad part is South Indians are used to having dahi bath at the end, but dahi has got calcium. So we are saying we can't mix dahi bath with something else, with food before. If I had methi, before that, it gets a little confusing, I think, for me.
Yeah, actually a very valid thing. See, when we talk about dahi bhat or basically curd rice or anything like that, so curd is also, apart from calcium, it's also an excellent source of your probiotic. So anyways, it won't harm you that much, and also if you, let's say for example, if you're having curd with your bhat, why not you add some drumstick leaves or drumstick powder to it? Even drumstick is an excellent source of your fiber and an excellent source of your calcium as well. So these are few strategies which we can employ if we are combining certain food items together.
Thank you, Kanishka ji. This has been an excellent presentation.
Yeah,
Really, really appreciate it.
And we selected the foods and all. We come to know what to eat, and the medicine, the dialect. We don't understand sometimes everything. Yes. So
Yeah.
this was good.
Thank you,
Thank
Kanishka. Like I
Thank
know like, we are over time, and thank you for being such a wonderful presenter. Like we got so much of, good information, and thank you for patiently answering our all senior questions. Definitely would like to have you again back as being colon cancer month, this awareness month, this March. It's a wonderful presentation. Thank you so much.
you. Thank you
So
you
much.
everyone.
Thank you so much, Nanda.